The Pan American Health Organization, Paho, proudly celebrates its 120th anniversary of service and achievement in the Americas. Paho was founded in December 1902 as a multinational initiative to control the spread of epidemics from one country to another. It is the oldest international public health agency in the world. Paho began operating in Belize in the early 1950s and formalized its relationship with the government of Belize in September 1982.
For everyone in the 90s in our region, health reform was top priority. How do we make the health sector meet the real needs of all populations, and in this case Belize, granted that what existed before was no longer sustainable.
Paho committed to providing technical cooperation to strengthen the capacity of Belize's health sector and improve the health of the people of Belize.
Paho brought all the information, the technology that was required for us to work effectively and efficiently against diseases, and specifically the immunizable diseases.
Paho then assisted the country to define a pivotal health plan at that time, which was based on equity. Today, everybody's talking about equity, but that was 1995, and the name of the National Health Plan was the Quest for Health Equity.
With its roots in fighting communicable diseases, Paho has supported the government over the past 7 decades, responding effectively to endemic, epidemic, and pandemic outbreaks. It provides public education and specialized training, financial and material resources, access to vaccines and medication, national capacity building, and targeted technical cooperation. Through its support of expanded vaccination, Paho has assisted the countries of the Americas, including Belize, in successfully eliminating 6 vaccine-preventable diseases: smallpox, polio, rubella and congenital rubella syndrome, measles, and neonatal tetanus.
We eliminated measles from the Caribbean in 1991. We had what we call a major campaign to eliminate measles throughout the Caribbean. And we started as if we have never been vaccinating children. We started from scratch again.
The Malaria Eradication Program, which began in 1974, is one of the great success stories of Paho's collaboration with the government of Belize. Since December 2018, Belize has reported 0 cases of malaria, placing the country well on track toward malaria elimination.
Having reached the status of malaria elimination does not mean that you do nothing else related to malaria prevention. And so that work needs to continue, the work of the laboratory, the work of the various vector control officers must continue in Belize so that Belize continue to remain malaria-free.
For other vector-borne diseases like dengue, chikungunya, and Zika, Paho led public health responses in Belize, which included surveillance, prevention and control, and the mobilization of resources. Paho has also been instrumental in the national response to HIV/AIDS endemic in Belize through public education initiatives to create awareness and increase understanding about HIV, and to encourage people to get tested. As the burden of HIV and tuberculosis continues to be relatively high in the country, Paho, in cooperation with national partners, assisted with the development of the National Strategic Plan for HIV/STI, viral hepatitis, and tuberculosis. The Paho office in Belize has grown from a program office with only 5 staff members to a full country office with 27 staff, much needed human resources to address public health threats. The emergence of the COVID-19 pandemic in 2020 presented the greatest global public health challenge in recent history. Paho immediately mobilized to support the Americas in responding to this important public health emergency. In Belize, Paho supported the Ministry of Health and Wellness by training lab personnel to diagnose SARS-CoV-2, evaluating isolation and long-term facilities, providing technical guidance for decentralized testing, and supporting procurement of COVID-19 test kits, medical and laboratory equipment and supplies, PPE, and IT communication equipment and materials. Paho's technical support in developing a decentralized testing protocol sharply decreased the turnaround time for receiving COVID-19 test results, a critical factor in containing the spread of the virus. Paho facilitated the acquisition of COVID-19 vaccines through COVAX and supported the COVID-19 vaccination rollout, contributing to 64.62% of the target population being fully vaccinated by December 30, 2021. Paho has built national capacity through specialized training to address non-communicable diseases such as heart disease, cancer and diabetes, which have been leading causes of death in Belize.
Non-communicable diseases, again, that has evolved. So more and more in our offices, you have technical advisors focus on non-communicable diseases, which are so critical. They are responsible for 60% of the deaths in our countries and our societies.
Paho has been fostering multi-agency collaboration to promote healthy lifestyles to prevent NCDs. This included training sessions for primary school teachers on healthy diets, the importance of physical activity, NCDs and their risk to COVID-19, as well as building national capacity in public health systems, including governance, financing, medical technology, and information systems.
Investing in health information is not buying computers. It includes, obviously, having access to software and hardware, but it also means having a vision and a plan for your surveillance unit, for your information system unit, and eventually for your planning unit to all marry each other and begin that process of using data in a more active way to track diseases, to forecast diseases, and to look at health status.
In 2004, Paho supported the launch of the Belize Health Information System, which provides automated access to patients' information across clinics and hospitals, enabling continuing of care across local, regional, and national levels. This has increased Belize's capacity to produce, monitor, and analyze critical health data. With Paho's support, all public hospitals have been certified as baby-friendly hospitals, as have 3 public polyclinics. This allows mothers across Belize to receive care and the opportunity to breastfeed from the birth of their baby. With most of Belize's population living in low-lying coastal areas, many hospitals and health clinics lie in high-risk climate disaster zones. To address this concern, the Smart Hospitals Initiatives was launched in Belize in 2016 and to date has retrofitted 5 health facilities countrywide. In collaboration with the Ministry of Health and Wellness, Paho is providing safer, greener, climate-resistant health facilities to deliver care in disasters, generate operational savings, and reduce disaster losses. Paho has been Belize's steadfast ally in responding effectively to health emergencies in the aftermath of natural disasters. The launch of the National One Health platform in October 2022, a collaborative effort by the government of Belize and Paho, with funding support from the European Union (EU), is a significant step on the path to 2030.
It allows us to address the full spectrum of diseases, from the prevention to detection to preparedness, response, and management, and contributes to global health security.
So, although we have eliminated measles and other diseases are very, very low, we still have to continue to maintain a high vaccination coverage in order to keep the diseases out.
We need to improve the coverage of especially the childhood immunizations, the reduction in child mortality, in maternal mortality, the increase in life expectancy, Those are clear parameters that you could use to show the progress in health over the period of time.
Within the framework of its Sustainable Health Agenda for the Americas 2018-2030, Paho Belize will continue its decades-long commitment to the government and people of Belize in achieving the highest standard of health and well-being for all persons through universal access to health care, universal health coverage, resilient health systems, and quality health services throughout the life course.